The Royal Australian and New Zealand College of Obstetricians and Gynecologists and the Royal Australian College of General Practitioners recommend that benefits, limitations, and available options of reproductive carrier screening are discussed with all women who are planning a pregnancy or are in the first trimester of a pregnancy. When discussing the differences between smaller targeted panels and larger expanded panels, it's important to consider your patient's unique needs. At Eugene, we offer 3 distinct panels. CORE, a Medicare-funded screen for common variants associated with cystic fibrosis, spinal muscular atrophy, and Fragile X syndrome. A couples expanded panel, and a comprehensive carrier screening that screens for over 700 conditions that are recessive or X-linked. Each panel provides different coverage using different sequencing technologies. Simply, as the panel gets larger, the ability to detect an increased risk couple improves. While family history and ethnicity are no longer considered key markers for a referral, they should still be considered. Specific ethnic groups are more likely to carry certain conditions, and family history should be considered. The CORE panel is ideal for initial guideline-based screening. The pros are that it's Medicare bulk billed for eligible patients, genetic counselling is provided, and it's medically recommended. The cons are that there's limited screening because only certain variants that are common are screened. It requires staggered testing, starting with the biological female and then the male if the female is identified as a carrier. It screens for only 3 conditions: cystic fibrosis, spinal muscular atrophy, and Fragile X syndrome, which may not be prevalent in all populations and primarily affect people of white European descent. Limiting screening means that up to 70% of high-risk couples might be missed. Next, we have Eugene's expanded panel, which was formerly known as the couples panel. This is ideal for heterosexual couples seeking broader, cost-effective screening. The pros are that it's partially subsidised by Medicare, which reduces out-of-pocket expenses. It focuses on over 620 clinically significant conditions. Genetic counselling is included, and results focus on reproductive risk rather than individual carrier status, which simplifies interpretation. The cons are that it's designed for heterosexual couples only. It doesn't screen as many conditions as the comprehensive test. Whilst it does screen for severe childhood onset conditions, it doesn't include milder and variable conditions such as hearing loss. It requires a valid Medicare card, and no individual carrier status is reported except for cystic fibrosis, spinal muscular atrophy, and Fragile X in the female. Whilst this may be our largest panel covered by Medicare, it's by no means the most comprehensive, and it isn't right for everybody. For example, it's not appropriate for those using a donor and those who want to know about their individual carrier status. Finally, Eugene's most inclusive test is the comprehensive panel. This is ideal for any family dynamic, including individuals and those having donors. The pros are that it's the most comprehensive test available, screening for over 780 conditions. It's suitable for all couples who want an understanding of their reproductive risk. It's inclusive of diverse ethnic groups. It uses high sensitivity DNA sequencing for superior detection. It detects for over 80% of couples who are at an increased risk of passing on a serious genetic condition. It's the fastest path to understanding combined reproductive risk, and it includes genetic counselling. The cons, it's not Medicare rebated. If you'd like a more detailed side-by-side comparison of our carrier screening panels, including clinical details such as gene lists, detection rates, and Medicare eligibility, you can download our full carrier screening comparison table below this video. Feel free to save or print it for quick reference in your practice anytime. If you still need help choosing the right panel, you can reach out to our clinical team at any time. Please visit eugenelabs.com for more information.